Hey y'all, my name's Jessie McLaughlin and I'm a physical therapist and clinic director with Panorama Orthopedics. Today we're going to discuss what to expect in physical therapy following your combined labral repair and Ganz Osteomy. The main goals of physical therapy will include improving your range of motion, increasing your strength, normalizing your mechanics, and eventual return to prior level of function in sport. On your first physical therapy visit, we recommend that you bring a family member or caretaker with you who's going to be assisting you throughout your rehab process. One of the first things we will cover is reviewing the precautions based on your physician's protocol. One of the most important things following this procedure is ensuring that you are never pushing through pain. This will allow your muscles and your tissues to heal appropriately following the surgery that you just had performed. You will want to protect the front of your hip to minimize irritation to your hip flexor muscle. This muscle becomes stretched during the procedure and after the procedure can become very tight and irritated. You will be wearing your brace as recommended by your physician and it will block you from 0 to 90 degrees to protect the repair. Following your surgery, you will be utilizing crutches along with your brace. You will be trained on how to use the crutches by your physical therapist, and we recommend that you only put 20 pounds of weight through your leg for the first 6 weeks. This will allow the bones and the tissue to heal following the procedure. Following this procedure, you can expect to have some regional numbness along the front and outside of your hip. This is completely normal and more times than not will resolve with time following the surgery. When putting on and taking off your brace, be mindful of where it hits on your hip, as your incision from your Ganz procedure will be right on the front and can become irritated where the brace sits. We will also cover the importance of managing the swelling and inflammation in your hip. While swelling and inflammation is good for the healing process, pain management utilizing ice can also help mitigate some of the symptoms you are feeling. Prior to your surgery, your physicians will have ordered a CPM machine. This is going to assist with improving your passive range of motion during the first few weeks of your recovery. You will be given instructions on how to progress the range of motion in the pre-operative packet, as well as directed by your physical therapist during your PT sessions. When using your CPM machine, it should be relatively pain-free range of motion, and you can anticipate spending up to 4 to 6 hours in this machine per day. We will also cover range of motion exercises. Initially in your recovery, these will be passive, as directed by your physical therapist when you come in for your treatment session, but more importantly at home with your caretaker or significant other. These range of motion exercises, termed partner-assisted stretching, can be found on the Panorama website under the Hip Preservation tab. You will be instructed on how to perform these stretches along with your family member during your first visit of PT. During your first 8 weeks of physical therapy, the most important thing is to restore your range of motion and manage muscle spasm. The tightness in your hip following this procedure is very normal, and we will do things in therapy including manual soft tissue to help alleviate some of the stiffness you may feel. Passive range of motion stretching, both in physical therapy and at home, will assist with improving the mobility in your hip and decreasing the muscle tightness. We will instruct you in some basic stretching based on your physician's protocol that you will be able to practice at home to further assist with decreasing the tightness you're feeling. If you have access to a stationary bike, whether at home or in a gym nearby, this can further assist with improving your range of motion following surgery. We will also teach you some basic strengthening exercises to help improve the activation of your quads, your hamstrings, and your hip muscles following this surgery. These exercises should always be performed pain-free and will be progressed as directed by your physician's protocol and your physical therapist. At 6 weeks post-op, we will begin to wean you from your crutches. Keep in mind that this could take 1 to 2 weeks as it is entirely dictated by your pain levels and response to walking normally again. During the first 8 weeks, you will be cleared to perform blood flow restriction therapy based on your tolerance. Blood flow restriction therapy allows your muscles to exercise in a low oxygen state. These exercises help to improve your muscle strength, endurance, and tolerance for activity at a faster rate than it would without the BFR training. We will utilize this more times than not in a low load position with light resistance and will increase progressively based on your tolerance. 2 to 4 months following your surgery, we will continue to progress your range of motion both passively and actively. we will progress your stretching to continue to improve your flexibility and mobility of your hip joint. Keep in mind, most of the exercises that we're going to be doing will be performed on your other leg as well, as this leg has been taking over for your surgical side since the start of your surgery. To further assist with decreasing muscle spasm and stiffness, your doctor and therapist may implement dry needling therapy. This can further assist with decreasing muscle spasm and will be implemented at the point following your surgery based on your physician protocol. During the 2 to 4 month phase of your rehab, once you come off your crutches, we will work on some pre-gait and walking mechanics to further assist with normalizing your gait pattern. Your strengthening exercises will be progressed based upon the physician protocol and your pain levels and activity tolerance. These exercises will start from more table-based exercises and then progress to more weight-bearing and functional strengthening activities. The exercises will continue to emphasize balance, proprioception, and neuromuscular control to help normalize your gait mechanics and tolerance for functional activities. The general concept of months 2 to 4 following your surgery is that your strength and motor control will increase simultaneously as your activity level increases. Note that at week 12, you'll be allowed to use the elliptical. About 4 months following surgery, some patients may discharge physical therapy depending on their activity level and functional and recreational goals. For those that want to do more advanced strengthening, including plyometric exercises, higher level of functional strengthening, as well as returning to run, these patients can expect that they might be continuing with their physical therapist throughout this phase of rehab. Typically, patients can expect to be returning to run around 5 to 6 months. 6 months following surgery, we will begin some sport-specific strengthening. This will include higher level activities including plyometrics, jumping, running, cutting, pivoting, and any activity that you may need to do for your sport or recreational activity. At this point, we also will run a return to sport test, following which the results will be used for your full return to sport. Patients can anticipate a full return to sport or high level of activity around the 9 to 12 month point of your rehab.